My name is Elena Tejada and I'm gonna be reading chapter 14, Symptoms and Signs. Describing problems. The problem which a patient reports to the doctor are called symptoms. For example, pain or nausea. Signs are what the doctor finds, also known as findings. On examining the patient, for example, high blood pressure or a rapid pulse rate, symptoms are also known as complaints. To report a patient's symptoms or complaints, doctor says, Mr. Farnsworth was admitted complaining of chest pain. In case notes, the abbreviation C/O is used. C/O chest pain. Presentation. Patients say they went to see the doctor. Doctors say the patient present. The symptoms which cause a patient to visit a doctor or to present is called the prescribing symptom, presenting complaint, or presentation. His presenting symptom was chest pain. His presenting complaint was chest pain. He presented to his GP with chest pain. The usual presentation is chest pain. Talking about symptoms. Symptom, meaning and patient say. Symptom, tiredness, lethargy, fatigue, lassitude, meaning loss of energy. Patients say, I feel tired all the time. I feel completely worn out. Lately, I've been feeling completely exhausted at the end of the day. Symptoms. Malaise, meaning general feeling of being unwell. Patients say, I feel unwell, I don't feel well, I've been feeling off color for 2 days, I haven't been feeling myself for a week, I've been out of sorts all day. Symptom, anorexia, meaning loss of appetite. Patients say, my appetite is very poor, I've been off my food for days. Symptoms, weight gain, meaning increase in weight. Patients say, I put on 8 kilos in the last year, I gained 5 kilos. Symptom, weight loss, meaning decrease in weight. Patients say, I'm not eating any less than usual, but I have been lost a lot of weight recently. Symptom, constipation, meaning hard, infrequent feces. Patients say, my motions are very hard, I've been quite constipated lately, I'm not very regular. Note, the verb feel is also used with other adjectives such as hot, cold, nervous, anxious, dizzy, weak. She said she felt dizzy. That's all for the chapter. Thank you. Chapter 15. Blood. Full blood count. In the investigation of blood disease, the simplest test is a full blood count, FBC. A full blood count measures the following in a sample of blood: the amount of hemoglobin, the number of the different cells, red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes, the volume of the cells, the erythrocytes sedimentation rate, ASR, a measurement of how quickly red blood cells fall to the bottom of the sample of blood. Anemia. Anemia is one of the common diseases of the blood. It may be due to bleeding, loss of blood, excessive destruction of red cells, and low production. For example, because the diet is lacking or deficient in iron. A medical student has examined an early patient with a very low level of hemoglobin and is discussing the case with her professor. What's the most likely diagnosis in this case? Student, most probably carcinoma of the bowel with chronic blood loss. What's against that as a diagnosis? Well, he hasn't had any change in his bowel habit or lost weight. What else will you include in the differential diagnosis of severe anemia in a man of this age? He might have leukemia or some sort of or plastic anemia, but that's rare. It would be very unusual. Another cause is iron deficiency, but he seems to have a adequate diet. Okay, now there's another cause of anemia, which I think it is more likely. Chronic bleeding ulcer? Yes, that's right. But that's about Peyronie's anemia. Can you exclude that? Well, he's got none of the typical neurological symptoms like paresthesia. Pernicious anemia. Jordi Pons, the medical student from Barcelona, has made some language notes in his textbook. Pernicious anemia, PA, is a condition in which there is atrophy of the gastric mucosa with consequent failure of intrinsic factor production and vitamin B12 malabsorption. The onset is insidious with progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of inefficient red cell production in the bone marrow. A red cell tone glossitis is sometimes present. Patient present with symmetrical paresis in the fingers and toes, early loss of vibration sense, and progressive weakness and ataxia. The spleen may be palpable. So we got onset, meaning beginning, insidious, slowly developing, pallor, lack of color, mild, slight, jaundice, bilirubin, breakdown, division into smaller parts, bone marrow, soft tissue in the cavity of bones, symmetrical, each side the same, vibration sense, ability to feel vibration, progressive, continent to develop, palpable, can be felt with the hand. Bones. Some common English names for bones. English name, anatomical name: skull, cranium, jawbone, mandible, spine, vertebral column, breastbone, sternum, rib, costa, collarbone, clavicle, shoulder blade, scapula, thigh bone, femur, kneecap, patella, chin bone, tibia. Fractures. A fracture is break in a bone, sometimes of different types of fracture. Green stick, displaced, comminuted, impacted, open, compound. A pathological fracture is fracture in a diseased bone. A fatigue or stress fracture is due to repeated minor trauma, for example, long distance marching or running. Treatment of fractures. When the fragments of a broken bone heal and join together, they unite. Union may be promoted or helped by reducing the fracture, replacing the fragments in their anatomical position if they are displaced. After reduction, excessive movement of the broken bone is prevented by fixation, either external, for example, a spleen or plaster of Paris cast, or internal, for example, a pin or a plate and screws. A displaced fracture which is not reduced may result in Malonian, incomplete or incorrect reduction. Now to the right, we have a plaster cast, a pin, a plate, and screws. Note, the verb reduce has several meanings in medicine. To make smaller, I think we better reduce the dose of your tablets. In surgery, to return to anatomical position. An hernia can normally be reduced by manipulation. In chemistry, to remove oxygen or add hydrogen. Nitric acid is a reducing agent. Childhood. Milestones. Childhood is a period during which a person is a child. It ends with puberty, the onset of social maturity. Infant is another word for a young child. Infancy is the period of birth until about 5 years of age. The milestones in a child development and the ages at which they usually occur are sitting by 9 months, crawling by 12 months, first words by 18 months, walking by 18 months, and talking to word sentence by 3 years. Common infectious diseases. Disease common name: marbella or rubella, measles, rubella, German measles, varicella, chickenpox, infectious parotitis, mumps, pertussis, whooping cough, acute laryngotracheitis, grub, scarlatina, scarlet fever, rheumatic fever, tetanus, lockjaw, poliomyelitis, polio. Colic disease. A medical student has made some language notes while reading her textbook. Colic disease is a disease of the small intestine caused by sensitivity to gluten. It can present at any age, but in infancy it appears after weaning out of cereals containing gluten. The clinical features include diarrhea, malabsorption, and failure to thrive. There may be signs of malnutrition and there may be some abdominal distension. There is delayed growth and delayed puberty, leading to short stature in adulthood. Sensitivity to, having a negative reaction to, weaning, changing the diet from milk only to solid foods. Clinical features, the symptoms and signs of a disease: malabsorption, poor absorption, malnutrition, poor diet, nutrition, adjective, malnourished, thrive, grow strongly, distension, swelling, delayed, later than expected, failure, when something that is expected does not happen, stature, size, especially height, etc. The endocrine system. Excess and deficiency. An excess, too much, or a deficiency, too little, of circulating hormones causes a wide range of medical conditions. For example, hypothyroidism and hypothyroidism, where there is an excess of hormone. One form of treatment consists of giving the patient something which inhibits the production of that hormone, as in the use of carbimazole to treat hypothyroidism. When a hormone is deficient, treatment may be by replacement therapy, for example, injections of insulin in the treatment of type 1 diabetes. Doctors say sufferers of type 1 diabetes are deficient in insulin. Negative feedback system. TRH, thyrotrophin releasing hormone, is secreted in the hypothalamus and triggers the production of TSH, thyroid stimulating hormone, in the pituitary. TSH stimulates the TSH receptor in the thyroid, to increase synthesis of both T4 thyroxine and T3 triiodothyronine, and also to release stored hormone producing increased plasma levels of T4 and T3. T3 feeds back on the pituitary and perhaps the pituitalamus to inhibit TRH and TSH secretion. Goitre. An enlarged thyroid gland is called a goitre. The enlargement may be diffuse, involving most of the gland, or localized, limited to a particular area, as in solitary single nodule. The increased blood flow in diffuse enlargement, for example in Graves' disease, may give rise to a palpable thrill vibration filled with the hand, and an audible brute noise heard through a stethoscope over the gland. A letter of referral. Mr. Davis' doctor has referred her to an endocrinologist. Dear doctor, I would be grateful if you would see this 50-year-old woman who has lost 20 kilos in weight in spite of eating more than usual. She describes herself as overactive, and at first she thought the weight loss would do to this, but more recently she has developed palpitations, urea, and heat intolerance. She has noticed that her hands have a tendency to shake. Her symptoms suggested hypothyroidism, and this was confirmed by my examination, which revealed an enlarged thyroid, red sweaty palms, and a fine tremor of the hands. Heat intolerance, inability to cope with high temperatures, overactive, more active than is usual, palpitations, awareness of rapid or irregular heartbeat, fine tremor, very slight involuntary movements. The eye. Parts of the eye. Eyebrow, eyelashes, pupil, eyelid, iris. Examination of the eye. Here is an extract from a textbook describing of how to examine the eye. Look for squint, strabismus, dropping of the upper lid, ptosis, or oscillation of the eyes. Nystagmus and lid lag. The upper eyelid moves irregularly instead of smoothly when the patient is asked to look down. Next, examine the pupils and note whether they are equal in size, they are regular in outline, evenly circular, they are abnormally dilated, large or constricted, small, they react normally to light and accommodation, focus on near objects. To test their reaction to accommodation, ask the patient to look into the distance, hold your finger in front of their nose, and ask the patient to look at it. The patient should come together or converge, and the pupils should constrict as the patient looks at the finger. Checks also for cataract, opacity of the lens. Retinopathy. Hypertensive change in the retina can be classified from grades 1 to 4. Grade 1, silver wiring, increase in the light reflex of the arteries only. Grade 2, grade 1 plus intravenous nipping, indentation of veins where they are crossed by arteries. Grade 3, grades 2 plus flame-shaped hemorrhages and cotton wool exudates. Grade 4, grade 3 plus papilledema. The gastrointestinal system. Examination of the abdomen. Here is an extract from a textbook describing of how to examine the abdomen. Note: if the abdomen is distended by fluid or gas, the presence of fluid can be confirmed by demonstrating Tiffin dullness, percus or top, first with the patient lying supine, flat on their back. Then ask the patient to lie on one side and percus again. If fluid is present, they do note her on percussion moves. Palpate each region, feeling for tenderness, pain when touched, or masses, palpable enlargement of tissue. Note also any gargling or rigidity shown by contraction of the abdominal muscles. Gargling may be due to tenderness or anxiety and can be reduced if the patient is persuaded to relax. Rigidity, however, is constant and is due to peritoneal irritation. Rebound tenderness is pain when the palpating hand is suddenly removed. It is a sign of peritonitis. Listen for bowel sounds. The feces. There are several words for the feces. Doctors sometimes say there was blood in the tools. Have you passed black tools? Patients sometimes say my motions have been very loose lately. Bowel movement. It used to refer to defecation. Have your bowels moved today? Have you had a bowel movement today? Bowel habit is a medical expression meaning the pattern of defecation. Have you noticed any change of bowel habit? How often do you open your bowels? Are you going to the toilet more often than normal? Change in the bowel habit can be constipation, hard, infrequent stools or urea, frequent soft or liquid stools. Normal stools are brown in color and semi-solid or firm. The consistency or degree of hardness and softness can be shown on a scale: hard, firm, semi-formed, soft, loose, liquid, watery. The color can vary from black to altered blood, as in melanoma, to yellow, gray, or even white. Melanoma stools are often described as sterry, like tar, the black sticky substance that is used in road making. The stools might be red when fresh blood is present. Blood that can only be detected with a special test is called fecal occult blood (FOB). When there is a high fat content, the stools are pale and are sometimes described as clay color. The stools that are large in volume are described as bulky. A bad smell is described full or offensive. Normal reproductive system: womb, ovary, neck of one, cervix, fallopian tube, salpinx, vagina. Menstruation. A period is a common name of a menstrual monthly period. The onset of menstruation is known as menarche. The last menstrual period is commonly abbreviated in doctor's notes LMP 2/52 ago. Means the last menstrual period was 2 weeks ago. The menstrual cycle, or length and frequency of periods, is usually written in the form 4/28, which means lasting 4 days and occurring every 28 days. If a period lasts more than 4 or 5 days, it can be described as prolonged. The term heavy periods means excessive blood loss. Menorrhea often means the presence of clots, coagulated blood. The term period pains means dysmenorrhea or painful menstruation. The time when a woman stops menstruating, normally at about the age of 50, is called the menopause or climacteric. In everyday English, it is known as the change of life or simply the change. Symptoms of the menopause include hot flushes, sudden sensation of heat, and night sweats. Gynecological consultation. A gynecologist is talking to a 30-year-old woman. Gynecologist: are your periods regular? Patient: yes. How often do you get them? Every 4 weeks. How old were you when you started to get them? About 12. When was your last period? A week ago. How long do the periods last usually? 4 or 5 days. Would you say they're light or heavy? Light. Do you get clots? No. Do you get period pains? Not really. Is there any discharge between the periods? A little. What color it is? White. Contraception. For women, methods to prevent pregnancy include the oral contraceptive pill, known as the pill, the diaphragm, and the intrauterine device, EUD, or copper coil. Condoms are available for both men and women. The heart and circulation. 1. Shortness of breath. Shortness of breath or breathlessness is dysphonia. At first, this is caused by exertion, physical activity such as climbing stairs, but in severe cases, it may be present even at rest. A patient who is breathless when lying flat, orthophonia, for example, in bed, will turn to sleep raised up or on 2 or more pillows. The abbreviation ASOBOE stands for shortness of breath on exercise, or on exertion, or on effort. Patients say, I get terribly short of breath climbing stairs. Doctors can ask, how many pillows do you sleep on? Heart rhythm. The normal resting heart rate is 65 to 75 beats per minute. In athletes, it might be as low as 40 beats per minute. In extreme athletic activity, the heart rate can go as high as 200 per minute. The heart rhythm may be regular or irregular. In an irregular rhythm, arrhythmia, there may be early beats which interrupt the regular rhythm. Premature beats, or the rhythm, may vary with respiration, or it may be completely irregular, as in fibrillation. When patients are aware of irregular, they describe the symptoms as palpitations. Case 4. A 22-year-old student was admitted to hospital with a long history of heart problems. She had been incredibly tired with shortness of breath on exertion, orthophonia, and palpitations. A mitral valve replacement had been carried out 3 years previously, and this had stabilized the symptoms of heart failure, but was followed by episodes, attacks of atrial fibrillation, which had been particularly severe for the 6 months before admission. Heart failure. Heart failure occurs when the heart is unable to maintain sufficient cardiac output, the amount of blood pumped by the heart each time minute, for the body's needs. It may involve the left side of the heart, the right side, or both. In left heart failure, the main symptom is breathlessness. The symptoms of right heart failure include peripheral oedema, swelling, beginning in the feet and ankles. This is known as pitting oedema. When a finger is pushed into the swelling, it causes a small depression or pit. We got aorta, tricuspid valve, pulmonary artery, pulmonary veins, mitral valve, septum. The heart and circulation. 2. Physical examination. Medical examination is normally carried out in 4 stages: inspection, looking, palpation, feeling with the hands, percussion, tapping with a finger, and auscultation, listening with a stethoscope. Note: the verb is palpate, the noun's palpation, not palpitation. Examining the heart and circulation. Here is an extract from a textbook describing of how to examine the cardiovascular system. Look at the lips, tongue, and nails for the blue discoloration of cyanosis. Cyanosis may be central or peripheral. Inspect the hands for clumping. Feel the radial pulse at the wrist and know the rate. For example, 70 per minute. And a rhythm, regular or irregular. The pulse may be irregular in first as well as time. Check that the other peripheral pulses are present. Measure the blood pressure and assess the jugular venous pressure (GVP). Palpate the chest of the apex beat. The normal position is the 50 left intercostal space, 1 centimeter medial to the midclavicular line. Feel for any thrills. Heart size might be measured by percussion. Listen for murmurs and other abnormal sounds. For example, friction rubs beginning at the mitral area. Murmurs may be soft or loud. A harsh murmur is loud and rough. Note the time of any murmur in relation to the cardiac circle. The most common murmurs are mid-systolic, in the middle of systole, pan-systolic, lasting of the whole of systole, early diastolic, mid-diastolic, late diastolic, pre-systolic, continued by listening in the tricuspid, aorta, and pulmonary areas. Areas of exclusion. The letters indicate the approximate position of the heart valves. We got P, pulmonary valve, A, aorta valve, M, mitral valve, D, tricuspid valve. The circles indicate the position for auscultation for cardiac murmurs indicating valvular heart disease. The ribs are numbered. Thank you.